Dear friends, good afternoon. I'm Dr. Keya Shivadey, specialist gynecologist in the Aster clinic Business Bay. Today I'm going to discuss a topic called endometriosis. It's a gynecological disorder which is associated with severe pain in women in general. How do we define this disease? I will explain you through this model. If any of you know about the uterus, then this is the uterus and this is vagina. These are the side tubes and the ovaries on either side. Now the lining of this uterus is called endometrium, and when this lining, endometrium, is not only in this place but also outside the uterus, maybe somewhere in the surrounding, either on the ovaries or on the tubes or behind the uterus, all the ligaments which are holding the uterus on top of them scattered all over, then this disease is called endometriosis. The incidence of this disease is almost 8 to 11% in general in women population and generally seen in 30s and 40s. And it is diagnosed by two symptoms which are very important. One is pain, second is infertility. Now, if you ask me the reason of this disease, the most common theory which has come up is retrograde menstruation. That means when the menstrual flow of this endometrial tissue is coming out through the vagina, that is normal, but when it passes through the tubes into the ovary or somewhere in the pelvis, then it gets implanted all over. And with each menstrual cycle, with the response to estrogen and progesterone, this small ectopic tissue, it grows, it thickens, it breaks down, and then it bleeds. When it bleeds, it irritates these normal tissue and surrounding structures. Then it leads to fibrosis. This fibrosis leads to adhesions. And then it makes its own neurovascular entity. There are pain substances which are being released, there is bleeding, and that leads to all the symptoms. And because of these adhesions, there is infertility. Now, if you ask me the risk factors, any woman who is exposed to estrogen at very early age, that means if menarche is attained early, menopause is late, and there is no history of conception at all, or if they have low BMI index, or excessive alcohol intake, or if there is history of endometriosis somewhere in their relatives like aunt, mother, or sisters, or if there is any Mullerian duct anomaly, that means when the uterus is growing, there is some kind of anomaly or defective formation that also leads to endometriosis. So these are and of course the menstrual cycle pattern, with which at times patient comes to us like they are bleeding for more than 7 days, or the duration between the two periods is less than 27 days, and in between the periods they have spotting, which is not considered normal. Now, the most common symptom of endometriosis, which is almost seen in 70% of the women, is dysmenorrhea. This dysmenorrhea is the painful periods. But this starts 2 days prior to the period starts and it continues throughout the periods. And with every period it worsens, which is called progressive dysmenorrhea. Like some of the dysmenorrheas, they get sorted once a woman is married or sexually active, but this dysmenorrhea becomes worse and worse over the period of years. Second one is dyspareunia. That means during sex they have painful intercourse. Third is, most commonly seen, is chronic abdominal pain. Even when they are not having menstruation, there is lower backache, abdominal pain, and at times radiating pain to the legs. Then at times during periods they have painful urination and painful defecation, means when they are passing stools there is pain. And besides this, fatigue and irritability, and depending on where the endometriosis, the symptoms come. What are the remotest sites of this endometriosis? It can be seen even in the lungs, brain, and the skin. But the most common site it is found is the ovary, because that is the first place where it gets implanted, on the tubes, around the tubes, behind the uterus, because these structures are lying generally behind the uterus. So spillage comes here, which is called pouch of Douglas. So here, the ligaments which are here on the surface of the uterus, and of course sometimes on the bladder and the rectum. So symptoms differ from the position of the endometriosis. Now the one which is present on the ovary, what it does, because it is implanted there and the bleeding happens, so every month when it bleeds, it's not a massive amount of blood, just a drop of blood. It gets collected over the period of years, and then it is seen as endometrioma, that is the cyst of the ovary, with which we can